Start by promising not to mention that I don't have any orange on. There is an orange piece of paper here, however, and I'm not to make any reference to any airlines. So, I've been asked to talk to you about looking at core enablers within the supply chain. And I'm just pressing this little button here and hoping something will happen. Okay. So, we've heard from the MHRA, from the patient's perspective, the importance of safety around unique device identification. So my part is more looking at some of the enablers that the supplier community needs to look at adopting before we get to my colleague Alan's part about the hospitals. So, if we just have a little remember what's actually in the procurement strategy around the mandate for e-enablement. The important bit is that actually the data pool is key here. So if we actually just look, by enabling suppliers' product data within a data pool, GS1 certified data pool, by default, we have to put GTINs on our products, and we have to assign ourselves GLNs to our locations. I'll go into each one of those in a moment. So I started out trying to think how I could talk about key enablers in the supply chain. And I came up with this grey linear line in the middle, and I was a little bit like, goodness me, if I try and map all of those specific key enablers to this, we're going to be here for a week and not my 15 minutes allotted. So what I chose is just some key ones. So if I start with a GTIN, I mean, the GTIN's the piece that everybody always talks about. It's the big nirvana. It's, you know, GTINs, get your barcodes onto your products, make sure they've got the right sort of codes on them. That's fine, but actually, as a supplier, we have GTINs for our products. We actually make sure that we have the right barcodes on our products. Do we use those internally? No, we don't. When a hospital actually asks us for copies of these codes, people always come running to me with a spreadsheet, not even a disk, Ben. It's not even a disk, mate. It's an Excel spreadsheet, saying, we need to fill these for this hospital. And I'm saying, okay, no problems. We need to find out what purchasing volumes and quantities that these guys do, so we give them the right GTIN. So it's one thing to have a GTIN, it's another thing to make sure it's the right one. Because of course there's 3 layers, an each, an outer, and a pallet. So these are really, really important. I'd like to kind of hide my 3M badge at this point and say that for every single product that we've got at least 5 identifiers. This is the real world stuff. We've got a SKU number, a stock number, or a long ID. That starts that bit. That's why we know where it's manufactured. Marketing teams and sales guys, our point of sale data is all mapped to a short ID. So you hear salespeople walking around going, oh, a 4709 or a 3421, whatever that is. To them, that's great, but that's not what we need to enable this standard language. Another one that I'd just like to flag actually was brought about in 3M way before I joined the company. I don't see us ever being able to get rid of in the short term. Customer part numbers. Somebody had this great idea that we would be a brilliant company to do business with and brilliantly easy to do business with if we stored all of the hospital's part numbers in our system. Bad move. I'm sure that was somebody like some Six Sigma black belt that had got a project to go, how do we make sure that, you know, we've got these customers buying from us because we're marvellous? No. And it's just a nightmare. So that's my little nightmare badge and an exclamation mark, because until everybody moves to using GTINs as the identifier that they order from 3M, it's a hard task. So if we choose to use GTINs as an identifier for our products, that is absolutely the right key to enabling electronic ordering. So, my next biggie, GDSN. I don't know if you're feeling a bit like acronym soup here. Is everybody keeping up with the acronyms? These little smiley faces. a bit. Okay, global data synchronization, really, really important. So what we need is, once we've got a product identifier, the GTIN, we need to put it somewhere where this data can be shared. And this is a GDSN pool. I believe there's about 31, 32. I think they change by the week, actually. I think it was just to set me up for a fall. And the importance here is that as a supplier and a trust, we will need to connect to at least one, well, we need to connect to one of these data pools in order for this data to be shared. Now, the Department of Health have come up with a series of specific identifiers for a patient, for a product. I'm building up to the point where I say 120 attributes-ish, depending on if your medical devices, pharmaceuticals, and which class your product is. So that sounds like an awful lot for one product, doesn't it? Yeah, this is a bit where you talk to me and go, yes, Rach. If we actually break them down, certain ones of them are mandated for use with the GDSN. The Department of Health have requested another group. Andy, he's selected another gang for traceability and safety. So it's not all that these products, attributes, are going to be requested for no good reason. They've all got a really, really justified reason to be in there. A thing I'd flag is, where does that data live today? So back at the ranch, we've got marketers looking after descriptions, whether something's got latex in it, images and things like that. In our supply chain systems, equally, those guys have got the weights and dimensions. And in our order management system, we've got price and customer. So we've got to figure out how to get the data from those systems in order to put it one place centrally so that all these nasty bespoke catalogues, all these little Excel spreadsheets will go away. That would be a big win for the supply chain. Okay, so another core enabler, and I've chosen this one for quite a good reason, in that I'm trying to figure out ways that could be relatively quick wins that we can implement. So SSCC is, if you imagine that the trust has sent a supplier an order, just as we're sending those goods out the back door, we can send you an electronic response to your EDI order that's an advanced shipping note. And as part of that, when the trust actually get the box of goodies arriving at the back door, they could scan the SSCC, Serial Shipping Container Code, and then they would know the stuff that was in that box. Now, that would save loads of time, but a little flag. It obviously needs a lot of trust between the trust, the trust and the supplier to make sure that we've put the right stuff in the right box, and you believe us to just zap it once and go, I trust that supplier, they're all right. So, GLNs, these are my favourite. That sounds a bit geeky, but they're absolutely my favourite. And I think they're a bit of an unsung hero in this. We hear about GTINs and stuff like that, but actually the GLNs, for me, they're a really, really quick win. So much so that I can do them. I don't need some techie boffin that's an engineer in production stuff that puts the dimensions on a box and whatever. But actually, the importance for me is that this is really, really tangible stuff. So have you guys got GS1 membership? Hopefully, yes. Number 2, that means that you'll have access to log in to your number bank. So over on the left-hand side there, you can't see it very well on here, but the first orange box, you select the type of number that you'd like. I'd like a GLN. Simple. The company prefix. If you're an SME, you actually have got an advantage because you'll have one prefix. 3M has got 4. I've no idea what 3 of them do, but I use the top one. It's fine, I'll start at the top. And then further down is all you would need to do is assign the address to that GLN. There's no science. That's as far as it is. And I can do that. If we all had laptops now, we could do that and assign those GLNs now. And actually, that's one tick in the box for the e-procurement strategy. You've done one thing. You've made that step. If you imagine what I've done here is You need a GLN, for example, for a head office, and then an order from location, and then where trusts would receive from. And equally, from a trust perspective, and this kind of goes back to Andy's point about you can actually link this tree of hierarchy of GLNs right back down to a patient. So you could go to a ward, to a bay, to a bed, right down to a patient. And ultimately, I've put just a little GTIN in there because we want to be able to link the products to a patient ultimately. And this is real. This stuff can happen easily, but the first step is about identifying yourself with a GLN. And there's no science to that because I've done it. It's that simple. So imagine if we all called the same thing. Everybody called this pen a white and silver pen. But if I asked the front row here, what's this called? It'd be silver, white, white, silver, long, length, blue, ink. We can't continue like that. So imagine if we all called the same thing, and each supplier was identified by a specific number rather than 3M or 3M Healthcare or 3M Space Care, 3M Limited, 3M PLC. We don't need any of that because we just have one location identifier. That then would create, if we shared that information, that is, that would create the perfect catalogue. And I'm gutted John's gone because we could have the perfect catalogue. If we've got the perfect catalogue, this will also have the price in it. And I know that's a contentious issue, but that data that goes into the GDSN network actually is, it will have and will need a price on it per trust, per thing they buy. Don't be afraid by that because the Department of Health already have that information. The information that goes into the GDSN is just between you and your customer. So that's going to create a perfect order. Imagine a perfect order, which can be traded electronically. We can return that order with an advanced shipping note that actually, if we apply an SSCC to the big box of goodies, this will allow the invoice to be a perfect invoice. And then the supplier would get paid without question. I did want to have the piece at the bottom saying about the perfect supplier, but I thought I wouldn't even go that far. That's way too much. So, title, subtitle, content, excellent that we've transferred this over brilliantly. Oh well, science, hey? So remember we went back to that linear process that I talked about earlier, that I thought that we just started at a really high level. I do feel that at the moment everything is quite linear. We're doing bits and bobs. We have absolute pockets of excellence in the NHS and in supplier land. And I don't necessarily hold myself up as a brilliant company that we've got everything right, but we know what we need to do. We are fragmented as a system, and we are inefficient as a system. And I think some of the things we've discussed this morning and we'll go on to discuss this afternoon will help reduce some of those efficiencies. And I think it's based around that we're not all talking the same language. And it's that standard that we need to implement. However, the e-procurement strategy really does bring all of this back together. So it looks a bit of a funny slide again. So my last core enabler for you guys is, I see this is our system, and actually those enablers are just outside that system at the moment. There's lots of them, they're brilliant, they're fab, but the one enabler for me is you. So we've got loads of acronyms, but actually the only way that we can implement all of those acronyms and bring about this massive change is you and me and GS1 with the guidance of the Department of Health to bring about this change. So we can do this in little steps. We don't have to do this big bang. This e-procurement strategy doesn't have to be enormous. We can take it in chunks and make a difference. So for anybody that's heard me present before, I've got my 3 hats that I talk about. So hat number 1, I work for a commercial company. We must do something, else not doing something will be a barrier to trade. the NHS needs to be able to buy products from suppliers in a really streamlined way. So as a commercial group, it's a must, else this will become a barrier to trade. Secondly, I don't know about you, but I'm a taxpayer. I pay an awful lot of tax. So the element of that tax, actually, that goes to the NHS, I need it to be used efficiently. All of this GS1 stuff, the enablement stuff, that's not in my job specification, but I'm really passionate about making sure that 3M take on its end of the bargain. So we need to do something as a taxpayer. And lastly, everybody in this room, even Mr. Photographer man, who's looking a bit bored, is a patient. So that's really important, that we do something and make that difference, because you never know when you're going to need the NHS. So that's why we need to do something. That little baby step, we must take it. Thank you.